This is a short video introducing the concept of mental health and mental illness in clinical psychology. In this approach, mental health problems are defined in terms of problematic patterns of thinking, feeling, and behaving. This is often referred to in clinical psychology as abnormal behavior. It is important to remember that what's considered normal is different in different times and places. So we always have to look at ideas about what's normal and what's abnormal in relation to any situation. Patterns of normal functioning vary. Also, values and belief relate to what is considered to be normal in any given situation. So there are a variety of explanations in everyday life in relation to what's considered to be normal behavior. The explanation that's given to mental health problems will lead to the choice of treatment. How the problem is defined and how it is represented is very important. However, individuals often have very little control over the treatment they are offered. Just one more point to mention is that we are now living in a pluralist society, so tolerance of diversity includes people who are different due to having atypical neurology. To use a new phrase, people who are not neurotypicals, for example, those with schizophrenia or autism. People should be able to find acceptance and respect in a pluralist society, even if they are different. Sometimes mental health problems are due to underlying disabilities, but people can recover and they can take care of their mental health. So this would be one of the benefits of a pluralist society, that diversity can be respected. Now I want to briefly look at the different treatments. The solution applied to the mental health problem can depend on the explanation given as to the cause of the problem. Firstly, if you believe that it's a biological or a chemical malfunction, then you go for the drug treatment. This is generally the mainstream view in Ireland at the moment. However, this would not address the causes of the problems. Those who take a Freudian perspective might see the problem as being in the unconscious mind, leading to talking therapy. For example, those who take a cognitive behavioral point of view would claim that there is faulty learning, and they would go about changing the thinking and modifying the behavior. Indeed, the research shows that thinking and feeling do influence each other. Our thinking does affect how we feel, and our feelings or emotions change the way we think. Indeed, there's plenty of research now that shows that thinking and emotions are complex interrelated systems. So you really can't separate thinking and feeling. Cognitive behavioral therapy can actually be especially successful in treating depression. Next, the systems approach is generally applied to families. It is applied where it is seen that there is a dysfunctional family situation, particularly in relation to children with problems. Therefore, the best approach would be to treat the whole family, if at all possible. A behavioral view would say that there was dysfunctional conditioning and the solution is to modify the behavior, and this still can be appropriate in some instances. A humanistic approach would see a need for personal development, therefore psychotherapy would be necessary. The humanistic approach can be good for individuals where the psychological problems are purely caused by the environment, or in other instances where an eclectic approach is used, or a mixed treatment approach. This is based on the view that mental health problems affect a person's development. So as part of a more holistic approach in therapy, it's now found in fact that psychotherapy has an important role to play for individuals in recovery. Then, causes of disorders. There's never a single cause. What you tend to find is causal patterns. Usually there's predisposing risk. Some individuals are more vulnerable than others, and this could be a biological predisposition, or it could be a trauma in early childhood, for example. Usually a mental health problem is triggered by something that happens and then reinforced within the situation. And in reinforcing what happens, is that once a person starts to occupy this role of a person with a mental illness, it's really difficult to get out of that role. It really does affect their recovery. And traditionally it was believed that people didn't recover from mental illnesses. So those old ideas still persist. Now we know this is not true, but the extent to which the person recovers does depend very much on the environment. Mental illnesses are just illnesses like any other, and the person really needs to have an opportunity to understand their illness and to recover from it, or to be in treatment or in recovery. Oops. Everyone needs to take care of their mental health. Just as a person who has a heart attack has to be especially careful in taking care of their heart, a person who has suffered from a mental health problem has to be especially careful when it comes to taking care of their mental health, avoiding stress and any bad situations. And it is important to recognise that recovery does take time, particularly in the case of a serious breakdown. It can take several years, and this needs to be understood by everybody. Not to rush the person back into working or studying or whatever, and to give them time, at least some chance and some time to recover. It is important to understand that stress is always playing a role. Stress is defined as an internal response caused by stressors. The causes of stress are in the environment. The stress is actually a response, a physiological response to these pressures or whatever from the environment. Another important point to note is that people don't just get any mental illness. It's just like having a predisposition to something like, for example, some people might get chest infections, or others might suffer from stomach problems or whatever. People with mental disorders are predisposed to develop a given disorder, so there is some predictability for an individual. Risk factors fall into three categories: biological, psychosocial and sociocultural. Biological factors include genetic factors, injuries or illnesses that affect the brain, the effect of substances such as pollutants, toxins or drugs, and lack of stimulation, so extreme examples of neglect. Psychosocial factors include both family and other social environments. This is often due to the situation that the person is in, possibly poverty or maybe family problems. Also in the social environment, bullying is a huge cause of mental health problems and depression, and unreasonable pressures and demands can be a huge factor for some individuals. Socio-cultural factors can actually increase vulnerability in some cases. For example, low socioeconomic status. People living in poverty are at more risk. Certain social roles can make a person more vulnerable. Prejudice and discrimination is a huge factor, and economic and employment problems are also issues. Nowadays that's huge, and and also how people can manage the social change and uncertainty that we all face. Sociocultural factors can also reduce vulnerability. Social support, understanding and acceptance, respect, love and a sense of belonging. These are very important in protecting a person against mental health problems. So that concludes this introduction to mental health and mental illness in the clinical model. I leave you with an extract from the DSM-4, which